So hello, Emma. Nice to sit with you today and have some of your time and energy, and it's always a pleasure talking to you.
Thank you, Christy. Likewise.
Thanks. I just wanted to inquire a little bit into your practice, maybe a description of some of the clients you're currently seeing and some of your approaches to therapy.
Yeah, sure. So I see quite a wide variety of clients. So I see individual clients, I see couple clients, I see families, and I also see children and adolescents. So I really enjoy having a kind of that ability to be able to move between different client bases, because they all help me be better at what I do. And the sort of foundation that underpins working with all those different clients is my specialisation is in relationships and relational thinking. So even when, for example, you're working with an individual client, there are times when you can sort of almost feel the presence of all the people that are important to them or have been significant to them in their life kind of being in the room with you. And like, as you know, as a therapist, really relationships are kind of the underpinning of most people's sense of well-being in the world. And because we have different kinds of relationships, friends, family, work, parenting, and then the more kind of complicated relationships of ex-partners and estranged members of family and those sorts of experiences for people, you know, you kind of, over the lifespan, people's relationships change. And not only do their relationships change developmentally, they change both in terms of their biological bodily experiences, but also transitions and education and career and geography. So one of the things I really love about working as a therapist is trying to join with people exactly where they are at in their life, and then helping them make sense of how they've got there and where they want to go to next.
Yeah, thank you for that. Yeah, I can see that we've touched on quite a big topic, which is that relational space, the interpersonal space where, yeah, a lot of things can happen for a client, a lot of a sense of who am I in the world as reflected by another, and then also the sense of how we develop, how we become, and then also issues, around patterns in attachment and the partners we choose, and how that even relates to our past history. So quite a rich topic to work with when you think of that everything somebody might come in to see you relates back to relationship.
Very much so. And when you were talking about that, it puts me in mind of something that you'll be really well aware of, is when clients first come to therapy, there's usually like something that they can identify that's brought them. So it can often be in the aftermath of divorce. It can be when they're struggling with the grief of a loss of a loved one. And then, so you might start with these things that are quite clear as a grief or a loss or a wound. And then through the work, because I prefer kind of depth work in therapy, you kind of start to understand, well, how does say a divorce connect to your experience of your parents or your previous relationships? And so it's really important with clients to get a really rich and quite detailed history. And some clients aren't quite sure why you'd want to know that, but part of our work is about collaborative work. That's like a really big piece of what we do. So I would always explain to the client why it is that I would like to take the history, and obviously it's always up to them what they want to talk about and what they don't want to talk about. But I think when you're working with someone and you really want to understand who they are and what their struggles and what their strengths are, you really benefit from having this quite rich history. And I think sometimes for clients, they can have these really big aha moments when they kind of connect something from their past to what's happening to them in the present. And that really helps them get some momentum around, okay, I know what it is that I want to change. And then you can start working towards those as treatment goals.
Yeah, that's incredible. Yeah, really seeing where somebody is now able to make a bit of a clearer picture of their life, their choices, their behaviors, even their motivations. What was really interesting that you said was this idea of therapy being collaborative. And I wondered if you could touch more on that a little bit.
Yeah, sure. So I think people who haven't had any kind of therapeutic experience can sometimes hold an assumption, partly from like films and books and TV, that the therapist is very much the expert and the client comes in and they feel like a patient, you know, in that sort of sense of like they're going to come and be a sort of passive recipient of the training and the expertise from the therapist. And whilst it's absolutely true, as a therapist, you do have expertise and you do have training, and it's often years and years of training, and then you keep training. It's like one of the things that you have to do as a therapist is keep going to different training and keep your practice really beautifully well-rounded and expert. But having said all of that, the collaborative piece is around a mutual respect for each other's, what we bring to the therapeutic experience. So the therapist has that training and that experience, but your client has expertise in their own lived experiences. They have experiences beyond yours as the therapist. So one of the first things you need to establish from the very first session is that sense that this is about reciprocity, about deep respect, around incredibly deep listening, about asking questions, never making assumptions, never making judgments. And so that when therapy is going really well, it's kind of like a emotional, intellectual dance between the two of you or three of you or four of you, whoever your clients are. And we know a lot more now with the lens of attachment theory, which is about like your early experiences of caregivers, that there's healing actually in having a really great collaborative relationship with your therapist. It doesn't even matter what you're actually talking about sometimes. It's just the felt experience of sitting with someone who wants to be there, who really cares about you, who wants to hear everything you've got to say. That in itself is a huge part of the healing.
Yeah, thank you. That makes a very clear picture for me of what I understand to be the collaborative experience. And you really talked about almost this sense of where the experience, the corrective experience, we might call it in therapy talk, which lives in that intersubjective space between self and other, where we do a lot of our learning about boundaries, about play, about even who we are based on those boundaries and how fluid they've been or how rigid they've been, and then often get set up so early. So when we step into a therapy session, even as therapists, the first time we've gone to therapy, we may have been more of in that passive role of, do I have agency here? Can I ask questions? Can I speak to how I feel with you right now? Even you as a therapist, can I say, hey, I'm feeling something here and I feel like you're judging me. And so really understanding that that's even part of it, is that in the space we have that capacity to say, hey, this is a relationship that has meaning and value and will add to that, so I can actually play out some of those dynamics and understand myself through that interplay.
I love that you brought that up because it brings to mind two things for me. One is you sort of brought us around full circle in the conversation around we are relational beings and we learn about who we are by being with somebody else. And so that's partly why I'm so interested in the relational piece of therapy, because that is how we understand who we are. And also it's dynamic, so we can change that. Like I think one of the things is we can think of ourselves as quite fixed. We're this kind of person with this kind of outlook, but therapy is all about freeing us up from that sense of fixedness. And I think the other thing that really strikes me when you talk about that is when you sit with somebody and talk therapeutically, there isn't any other relationship like that. It's not like a social relationship. You can actually say anything you want to the therapist, including making comments about how you're feeling about the therapist. So there's a kind of like, it's the most unusual relationship you can imagine in terms of that liberation piece. Like, yeah, you can say, you know, Christy, I didn't like the way you spoke to me then. And instead of getting some sort of angry response, you'll just be met with, you know, you as a good therapist would say, tell me more about that. Tell me about your feelings. Like, just accept that that's how I'm feeling in the moment and then work out what's happening to make me feel like that. It's like really powerful because we're just used to worrying about what other people think of us. And I think too, certainly when I started training as a therapist, I was like really amazed at how sitting behind the conversation when you train, it's actually like this really rigorous framework behind the conversation that's around what theoretical understandings you have, what technique to use. So it's this amazing mixture of like fully present emotionally with the client, but always drawing on what you've learned to structure the sessions. I found that really, I had no idea. I don't know what I thought therapy, what a therapist was doing. I think because I was kind of used to images of like Freudian therapists with the couch, and it seemed more ad hoc. But actually it's not at all. It's a really contained, loving, framed, safe experience.
Yeah. That's a lovely way to name it. That it is this safe space, that it is actually a shared space. And although, as you said at the start, one person may be claimed to be or have expertise in that role, it's really about what you're both choosing in that moment and what's arising in that relational field. And most likely, what will come up is things that have been there or have been imprinted or have been understood based on past relationships. And this is that fascinating thing about why we, again, repeat, why we do the same things we've done, and why it's hard to kind of move out of particular ways of being, particular thoughts, particular, patterns of behavior.
So true. And it puts me in mind of something that I learned early as a therapist, which is that idea of when we are very close to someone and you have a certain kind of closeness with your therapist, is that they will wear the many faces of people from your life. And then the power of the therapeutic process is like figuring out, well, who is this person that's sort of come into the space that we really need to think about how to give you some peace around that relationship or heal or improve that relationship.
Yeah, great. Thank you so much. I think that feels like it closes kind of a little bit of the discussion we're talking about, the power of that healing space, the power of that relationship to actually be a mirror to all the other dynamics and the other people that, you know, as we are socially connected and socially dependent, we sometimes get this sense that we can manage on our own, but actually a lot of who we are is based on others. So
Absolutely. The
Yeah.
changes in the relationship.
Yeah, so thank you so much for
Pleasure,
sharing
Christy.
and giving me some insight into your process. And yeah, it's been a pleasure.
Thank you.
Mm.